Hi everyone, welcome back to another episode of Diaries Women's Health Project. Today I'm joined by the beautiful Dr. Rumbi. So can you please introduce yourself and let them know who you are and what you do?
Absolutely. Thank you so much for having me on this project. I think this is important, and it's really, really important that you're shining a light on women's health. So my name is Dr. Rumbi Matenga. I'm a junior doctor. To be more specific, I am a GP trainee. Before I was a doctor, I was a midwife. And aside from medicine, I am also the Chief Strategy Officer of a nonprofit called Shake Africa and the co-founder of a startup called Glacy Health.
Perfect. And Dr. Rumbi, can you just explain your chosen topic for this series?
The topic that I thought was really important to highlight today was advocacy. Advocacy is something that I'm extremely passionate about, particularly relating to women, women's health, women's sexual and reproductive rights, and shedding a light on that, on how we can all be advocates and how we can also be allies, I think is really important.
So you've already covered why you think this is important. So I'm just going to ask, do you believe that women are exposed to places or societies which we can advocate for them?
Yes, I do. And what we need to do as a society and a group is make those avenues much more open. So the saying that you don't know what you can be unless you see it sometimes, I think is really, sometimes can be true. Mm-hmm. So relating to advocacy, seeing women in spaces of influence and power, particularly relating to their health and their rights, is important. Mm-hmm. And for that to happen, women need to enter those spaces. And once women are in those spaces, they need to bring other women up and ideally make it visible. So if I can see that, oh my goodness, the head of the chief nursing officer, just to use an example, in this hospital is a woman and she's really advocating for us. And then the deputy chief nurse officer now is also a woman. That's kind of, part of that advocacy. I guess from that standpoint is from a professional side. From the side of women's health and women's reproductive rights, in the UK, I think we are quite blessed. But other parts of the world, it's an area that needs to be highlighted more and where we need to be allies. So us maybe in the UK need to be allies to women in those spaces to help them advocate for themselves more and do what we can here to empower them to do so.
Yeah, I really like how you've touched on that, because I feel like when it comes to women's health, it's really important for us to all realise that it's something that's worldwide, it's a global problem. As much as over here in the UK, things are a bit better than other places in the world, it doesn't mean that, we're fine, like everything's fine in regards to women's health. So I do like how you've highlighted on that, because definitely helping other places, or just, I just want it to be a thing where everywhere in the world, like when it comes to women's health, we are able to say, yes, we know what's going on, and just see more women around the world, talking about themselves, understanding their health a bit more better. Because I feel like we're in 2024, but there's so many women who still don't understand like common problems like diagnosis, common signs of things that might not be, okay with their health. So yeah, it's really important. So I really like how you covered that. Do you think there's anything that we can do in our everyday lives? So for somebody who's watching this who may not even be a healthcare professional, is there anything that they can do, or it can be a healthcare professional, in regards to advocating for women in their lives?
So I can't remember the name of the book, but I was listening to an audiobook not too long ago, and it talked about our circles of influence. Mm-hmm. It doesn't matter what we do, who we are, we all have circles of influence. Even if we start at home, if you hear maybe someone saying something derogatory or something which you feel is actually demeaning, just challenging that in the politest way to say, actually, what makes you have that point of view, and have you considered this, and challenging opinions in, if you feel safe and comfortable to do so. That can be done anywhere and within whether my circle of influence is my family, my work colleagues, my community, or wider than that. That's something that anyone can start to do. The next thing I might suggest is to uplift voices. So allyship is something that really goes hand in hand with advocacy. If you find, let's say, social media, for example, there's someone who you think actually they're talking about something that's really important and needs to be spoken more about, although I don't feel that I need to speak about it, I might just reshare that post, because then people I know might hear that message, or I might send it to my friend to say, oh, I came across this, it was very interesting. The other day you mentioned that women should not be surgeons. Have you considered XYZ? Again, that's another way to challenge particular perceptions. Yeah. And the next thing is, depending on what you're passionate about, if it's advocacy from the perspective of women's rights, for example, we can look at being part of organizations like UN Women UK. They are always recruiting for their community. There you can hear about opportunities to advocate, to be involved with projects, and to help empower other women. So there's so many different scopes and spheres that people can use to start to advocate. And like I say, I think the most important thing is at home. It always starts within our own personal spheres and circles of influence.
Yeah, thank you so much for that information. So I want you to just talk more in regards to health workers into tech. So yeah, just explain even about your social media page and your project that you're planning to do or have started already.
Yes, so one of my many job titles is I am the co-founder of a tech startup, and part of that and learning within that sphere, I've met other healthcare workers that have transitioned to tech or that have their toe in tech and also in healthcare. And it's almost like a minefield of how do you get into this space? How do you learn these skills? And I started posting about it on social media, trying to share information that I wish I had known sooner. As a result, other people are telling me things. I'm like, oh my God, this is amazing. More people need to know about this. And that's how that aspect of, I would call it a little series that I have on my Instagram, which is for healthcare workers looking to transition into tech, how that came about. And again, it's all part of, if someone has opened a door and they've seen what's on the other side and what you need to get through that door, tell the rest of us that are still here that are trying to get through the door, so we don't have to necessarily work as hard as the first person did to get there. It's all about sharing information and uplifting all of us as a community as a whole.
Yeah, it's very, very true, and I absolutely love that. Can you just let us know your Instagram page or any social media platform that you want us to know about so that they can follow you as well?
Absolutely. If you want to follow me just for vibes, then TikTok. And my TikTok, I think, is DR Rumbi. If you're interested in women's health, advocacy, and also looking to transition into tech, Instagram is a good place. So my Instagram is Rumbi the Medic. I focus a lot women's health topics, but also because it's what's happening for me right now is tech skills and upskilling myself and just sharing how I've done that. So Rumbi the Medic on Instagram. For opportunities, work-related things, if you want to network in a more professional way, then LinkedIn, Rumbi Matenga on LinkedIn. And I'm on YouTube. I really do enjoy YouTube. I think I need to post more. My YouTube is Rumbi the Medic.
Thank you so much. So last and final question is, what would you like to see in the future in relation to advocacy?
I think I will focus on one particular area, which is the rights of women internationally. I would like the conversation of women's rights to no longer be a topic, because women's rights just become human rights. It doesn't become a separate thing where we're still trying to gain equity with other groups in society. So in the future, I would hope, relating to women's rights, we don't even worry about advocacy because it's just inherent. We all have equitable rights. We're all living in an equitable society.
Perfect. Thank you so much for joining us today, Dr. Rumbi, and thank you so much for sharing your knowledge. It's been a pleasure.
Thank you. Thank you for having me.
Thank you. Bye.